Thank you. And next, I'd like to call up Tammy Moore from ALS Canada.
Thank you very much. I'm pleased to be able to present today some of the overview of the strategic planning process that our organization embarked upon in the past year. And our intent with doing this is to show you what we did in our strategic planning and how we did a lot of stakeholder engagement in it, and then also to show you where we kind of got to. And what I was reflecting on while preparing the presentation, this initial slide deck when we presented to the board was 105 slides. You'll be pleased to know it's substantially less. Even being on the program committee, I wasn't going to take that advantage of you. But it also reflects on how many things that we're not saying in this presentation. So part of the process, of course, is being able to engage with stakeholders, but then being able to report back to them. So I share this slide only in that as we distribute this slide deck, this is only one of the first stages in being able to report back to our community. And so we just want to be cautious that we're not widely distributing this. And we do welcome feedback on what you see because it helps us to ensure refinement because so many things got moved as we were moving through this project. I think it's important to first consider the overall structure of our organization because it provides context. So ALS Canada has a board of 15 directors. That's a competency-based board that we work with. They do come from across the country, but they are not regional representatives at all. We then have 3 councils that report into the board, and they're able to give them very strategic insights and perspectives in different areas. So obviously our Scientific Medical Advisory Council, affectionately known as SMAC, they are our scientists, our researchers, our clinicians from across the country that help to inform our policy and process. Then we have our Client Services Advisory Council, so respirologists, clinicians, as well as people from the healthcare industry, as well as medical equipment providers, policy advisors from government, so again, helping to provide information. And then a Revenue Advisory Council, because of course we can't do this without funding. And I have VPs that sit on, or vice presidents who sit on each one of these councils to be able to ensure that we've got a good linkage there as well. I showed the Federation Council of ALS Societies across Canada because we do operate in a federated model with our partners. And while we have no oversight and we actually have one of equal votes to them, it's important that we consider it because in ALS Canada, we are directly responsible for service delivery of people living with ALS in our province of Ontario. So that's about 1,000 people living with ALS. But across Canada, there are approximately 3,000 people who are living with ALS. And each one of those societies is responsible for the direct service delivery within their province. We do have one of equal votes, so that means Prince Edward Island, which has 3 people living with ALS, can vote me off the island if we don't operate well together. So our strategic planning process started over a year ago in September 2016 when our board, in fact, started asking some very strategic questions. And this is just a small selection of what they are. But we wanted to know, and we had been really using a positioning line of treatable, not terminal. So what happens when ALS is treatable and not terminal? What does that mean for our population? What other things would need to be in place to be able to help support them? In Canada, most people will pass away within 3 to 5 years from diagnosis. But if you were to live longer, you might choose to keep working. What would we need to consider? So there were a lot of different things that our board had to consider. And actually, just to go back, one of the most important questions here too is, what is our relationship, contribution, and responsibility to the ALS community? And this was a challenging one because what is our responsibility in Ontario for the people who are living with ALS, in Canada, and our relationship with our partners and our clinics and our clinicians, and internationally why we are here today and why we make the investment in the Alliance. We structured a project governance for this particular endeavor. So of course the board is responsible for strategic planning. We're highly aware of that. But understanding that in between board meetings, we would need a subset of the board to be able to help support the work and ensure that we were on the right track. We then had a project team, and I can tell you that someone scheduled these meetings weekly for a very early time, and we did meet quite often. And then we had 2 different streams for execution. One was around engagement, and that involved our council chairs. And then the second, which involved more of the research, and we included people who had very good strategic planning expertise, but volunteered to be able to help support us in that role. We did establish a roadmap early on, and I'm pleased to say that even as the project evolved and grew, we were able to maintain our timelines. And this just gives you a quick idea about the work that we started on in February. When we first sat down with the board, and the board said, okay, what is really on the table? So yes, vision, yes, mission, yes, strategy. No, you can't play with the governance model. No, we're not touching the federation model. These are important things to know exactly what we were being tasked with when we started at the onset. We knew we wanted to have a lot of stakeholder engagement, and this gives you just kind of a quick overview, and I'll go into the some more of the specifics around each of these. But we wanted to make sure we were talking with people with lived experience, both from an ALS perspective, but as well people with longevity. We consulted, and we were very pleased to be a part of the Alliance and to have those strengths and relationships that we could easily reach out to. And I think it's an important consideration when we're talking about the value of the Alliance. We were talking earlier today about some of the formal ways that we might interact with one another, but I know for many of us there are many informal ways that we interact throughout the course of the year. And definitely we reached out to our international partners to help us. We worked on surveys, we did a very strong interview process, and then of course gathering some data. And then of course communication, both what would be the way that we would gather as well as communicate out. We did a stakeholder session. This was one of those add-ins. So if you're going to terrify a facilitator, tell them you're going to bring all of your stakeholders together in one room and facilitate a strategic planning session for an entire day. We did it, and it was actually very successful, and it was the first time that we've really brought together all of the groups into one particular event like this. And I can tell you as well, the add-on to it is that beyond strategic planning, something that has been very powerful is actually the engagement between these groups going forward. We had panel discussions with somebody who's been living 25 years, someone 10 years, a bereaved caregiver. We had a clinician panel to be able to talk to us about progress in the future and what that might look like. And then we broke out into focus groups, and we had roundtable discussions which reported back. This is just a snapshot of the group that was gathered there that day. So it was a really engaging and very powerful event. We did do external interviews, so we wanted to find out what were other opportunities that we might find or other risks that other groups might identify. So Canadian AIDS Society shared with us when they changed AIDS and were able to turn it from terminal to treatable, what happened as a result, and some of the stigma, some of the way people got fired from their jobs because the healthcare benefits were too expensive for companies. So what would we want to learn from that? Cystic fibrosis. If you're diagnosed with cystic fibrosis today in Canada, you can expect to live to the age of 56. Unfortunately, in the US, that would be substantially less at about 36. And they cite it largely due to multidisciplinary clinics. So that causes us to wonder, how would we interact differently with our clinics knowing this type of information? And then, of course, we talked to our partners around the world and learned a lot from them. And it was interesting as we were seeing new therapies come to market, even the way that different groups were embracing it or being a bit more cautious in their approach and what we could learn from them. These interviews as well were actually a structured interview. We had a very robust conversation that had been facilitated. There were at least 4 of us on every call, so we had the facilitator as well as a note taker, and then generally 2 other people to continue to ask more probing questions as we went through. So each interview we conducted was probably about 4 hours in total. We also wanted to make sure we weren't just speaking to the choir, so people who are already strongly aligned to ALS Canada and where our organization is going. And so we went to people who have fallen maybe outside of our regular community. We had great conversations with them, either with our chair, our past chair, as well as a facilitator and myself, depending on who we felt would be most appropriate to be able to engage with this group. And I can tell you actually that since then, these conversations have opened up relationships with these people in ways that we are very pleased to be able to see there's starting to be a stronger alignment again with our organization. As we started to drill down into the information and data, we started to really question it and wonder, what was it truly telling us? And I think a really important one here is how will ALS Canada be relevant? Because we really wanted to consider what are the things we should be doing, the things other groups should be doing instead, so that we didn't have duplication, but as well, what was the unique role that we would play in the future? So then leading into this, we came to a framework, and in that framework, we wanted to very quickly have just a quick 2-pager that we could each have on our desks to make sure that we were always aligned when we were doing our day-to-day operations. This is what it actually is currently looking like. So we did change our vision. We moved it from treatable, not terminal, to a future without ALS. We have our mission statement, and something that was important signal from the board was that we had added advocacy actually into our mission statement, which previously hadn't been there. And another really important part is it now says to what end. So we now talk about improving the lives of people affected by ALS, whereas previously we just said we would support people living with ALS. So a very different perspective. The other key thing, we did challenge our values, but the guiding principles was something that came through. And so in the guiding principles, those are the lenses that we now reflect through when we're looking at any decision we have to make. These definitely need a little bit more crafting and wordsmithing, but they're helping us to be able to start to shape it. This is the strategic model and the strategic impact statements that we have. And I can tell you our board is very literal, because the fact that the arrows actually don't go to the outside edges was important, because it helps to suggest the dynamic nature between research and research, support, and the information exchange. It also is always grounded by fund development, and recognition is within that. But people affected by ALS is at the center of everything that we do, and an important part that reminds us even in this simple model. So we liked our vision. It wasn't controversial, which was a nice thing to have. In our mission, I've again mentioned that it encompasses far greater than and gives us a direction. In our values, we tested them and they rang through. Our guiding principles, it was interesting because as we started to develop them, somebody said, actually, that sounds really familiar. And they went back to our Client Services Advisory Council and realized actually that they were grounded in the pillars that were there. So it was good to see that we were realigning and making sure that everything was consistent. Our strategic impacts are the things that we really want to, the ultimate impact that we want to have for the community that we serve. And it really is a future state. It's a statement of being, not doing. This is an important statement for us because we needed to differentiate that we have a different role in Ontario than we do for the rest of Canada, but we still have a responsibility and a role to play for the rest of Canada, especially since Ontario is the largest province in the country, and that we do have a leadership role. And when you get the slide deck, you can go through all the notes, but it will show you and demonstrate how carefully we considered each word that is considered within each of the impact statements. More treatments being available. Again, this is helping to be very directional as well for the research program that we do. And again, the notes to explain. People are empowered to make informed decisions about ALS. This is probably the biggest change for our organization because it really is reflective of a unique position that we have that no one else currently plays or could play potentially in this role. And again, the notes. So thank you very much.
She has a minute for questions.
I have a question for you.
Yes.
I have a loud voice on your microphone. This is an incredible amount of work. Just quickly, how did the previous strategic planning exercise that ALS Canada went through differ from this?
So the previous exercise was about 2 days, and it was an unsuccessful endeavor at the onset, and the board actually took it back and then had a smaller working group that worked it through a series of teleconferences. That was a different level of strategic plan and definitely a different level of engagement. And I'll say that the board took a strong initiative with this. We invested in it. We actually took some of our Ice Bucket Challenge funds and chose to make sure that we made the financial commitment to doing this project wholly. And what you're seeing is we still have a number of communication initiatives, including printed materials and things that will be coming out all the way till June of next year to truly ensure that we've got that alignment as we go through. Okay. Yes.
One of the things I think I heard you say is that through this process you were able to engage with government policy advisors. How on earth did you get hold of them?
Oh, we're fortunate. We have a federal ALS caucus. So it's actually a group of MPs who we have brought together who care about ALS. I help to support their meetings. They meet 4 times a year, and I can tell you, in fact, I've been on a cross-Canada tour now with a number of the MPs as they visited our clinics and research facilities across the country. So unfortunately, they came to care about the cause substantially because we lost a member of parliament in the past year and a half to the disease, but ultimately they just are very committed individuals, so we're fortunate. Okay. Thank you.